So the study that we presented here is about doing something in and around the tumor just before surgery. This kind of avenue has never been used in any study before. This is the first randomized trial with a robust efficacy evidence. There have been trials earlier, but not to the extent that this trial is. It essentially means that can I use something around the tumor to put it to sleep while I do a stealth attack on it of surgical intervention? That's the primary goal. What we did was 1,600 patients were randomly allocated to either receive the local anesthetic or not. These were all early breast cancer, stage 1 and stage 2 breast cancer women, and they had almost similar kind of hormone receptor positivity, HER2 positivity. Tumor size was about 3 centimeters, so fairly large compared to the standards in Europe or in US. The lymph node positivity was also identical on both sides. Their treatment that they received post-operatively was also similar. At the end of 6 years of follow-up, we found that the possibility of any recurrence reduced by about 26%. 1 in 4 distant or local recurrences were reduced. What was more pronounced was that 1 in 3 deaths were avoided, about 30% reduction in deaths due to breast cancer. Unlike the places where we treat micrometastases, that micrometastases exist and we are going to treat, wherein the disease-free survival appears much earlier and then we need to wait for slightly longer for overall survival or death to be reduced. So this is the first trial where both the graphs have separated for both the endpoints almost simultaneously, indicating that metastases were prevented, not treated. Since the local anesthetic is injected, and if I am doing conservation, it is removed instantaneously within 10 minutes or so. So there are no systemic side effects. The side effect profile of those who received local anesthetic was 0. In addition, about 33% recurrences locally at the site of the tumor were also reduced. And at a distant site, the reduction was almost 30%. So that's the kind of reduction in all endpoints, irrespective of what was being done, irrespective of what the prognostic category is.